Masturbation is one of the most natural forms of sexual expression and does not lose its importance with age. In fact, many adults over 60 continue to enjoy it as a way to relax, relieve stress, and maintain intimacy with their own bodies. However, the aging process brings changes to the heart, skin, hormones, and even mental health. Practices that were harmless in youth may carry greater risks later in life. Doctors caution that seniors should be mindful of certain habits that can turn a healthy activity into one that harms physical or emotional well-being. Understanding these mistakes can help seniors continue enjoying safe and satisfying self-pleasure well into their golden years. Number 1. Forgetting the heart's limits. Sexual arousal naturally speeds up the heartbeat, raises blood pressure, and stimulates circulation. For many seniors, this is perfectly fine. But for those with a history of heart disease, high blood pressure, or stroke, the extra cardiovascular load can be risky. Some older adults ignore warning signs like shortness of breath, dizziness, or chest discomfort during masturbation. Health professionals compare masturbation to light exercise. If a brisk walk leaves you exhausted, aggressive sexual activity may also strain your heart. The solution is not to stop completely, but to pace yourself, taking breaks, using gentle stimulation, and consulting your doctor about sexual safety. If you have heart problems, are simple ways to protect cardiovascular health while still enjoying pleasure. Number 2. Relying too much on pornography. As people age, sexual response often slows down due to lower hormone levels and natural changes in arousal patterns. Some seniors compensate by turning to graphic pornography or extreme fantasies for stimulation. While this may work short-term, it can desensitize the brain and make real-life intimacy feel less exciting. This is known as porn-induced sexual dysfunction, which often leads to frustration and disappointment. Another issue is emotional. Older adults, especially those living alone, may feel increasingly isolated when they replace genuine connection with endless digital content. The healthy approach is balance. Experimenting with memory-based fantasies, sensual touch, or relaxation techniques without becoming dependent on artificial stimulation. By doing so, seniors can keep arousal pathways responsive and intimacy meaningful. Number 3. Overlooking prostate and pelvic health. The prostate becomes a major concern for men after 60. Regular ejaculation may actually protect against prostate issues by helping clear old seminal fluid, but certain habits can cause harm. For example, squeezing too hard, delaying orgasm repeatedly, or sitting for long periods during stimulation can irritate the prostate or pelvic muscles. This sometimes results in pain, urinary problems, or inflammation. Ignoring prostate warning signs is another mistake. Symptoms such as painful ejaculation, blood in semen, or trouble urinating should never be brushed aside. These could be early signals of prostate disease. For women, pelvic health also requires attention. Postmenopausal changes like vaginal dryness or thinning tissues can cause discomfort or even tiny tears during masturbation if proper lubrication is ignored. Regular pelvic floor exercises and doctor checkups keep the sexual system in better shape. Number 4. Skipping lubrication and skin care. As the skin ages, it becomes thinner, more delicate, and less elastic. Masturbating without lubrication often leads to soreness, redness, or minor injuries. Unfortunately, many seniors either forget about lubricants or use the wrong products such as body lotion, petroleum jelly, or oils not meant for intimate use. These substances can upset the genital area's natural balance, leaving it prone to infection or irritation. Doctors strongly recommend choosing high-quality body-safe lubricants, either water-based or silicone-based, depending on personal comfort. They reduce friction, protect sensitive tissue, and make the experience more pleasurable overall. In addition, maintaining good hygiene, regularly moisturizing the genital area, and using safe, well-designed sex toys can prevent unnecessary damage to aging skin. Number 5. Ignoring the emotional side of sexuality. Masturbation is not just a physical act, it also affects mood, self-esteem, and emotional balance. Some seniors struggle with shame, guilt, or the belief that sexuality is only for younger people. These attitudes can create unnecessary stress and reduce enjoyment. On the other hand, some older adults may turn to masturbation excessively as a way to cope with loneliness or boredom, which can worsen feelings of isolation. Experts encourage seniors to approach masturbation as a normal, healthy aspect of aging, not as something inappropriate or shameful. Talking openly with healthcare providers, exploring mindful or meditative techniques during self-pleasure, or joining supportive communities can make the experience emotionally richer. By treating it as both physical and emotional care, seniors can benefit far more than if they focus on mechanics alone. Conclusion: masturbation after 60 should not be seen as a problem. It can be an excellent way to relieve stress, maintain sexual function, and connect with one's body. The challenge lies in recognizing that the body has changed with time. Seniors must take care not to overexert the heart, depend too much on pornography, neglect prostate or pelvic health, forget lubrication, or ignore the emotional side of sexuality. Handled wisely, self-pleasure can remain safe, enjoyable, and even beneficial to long-term health. Instead of avoiding it altogether, older adults should approach it with patience, gentleness, and self-awareness. By avoiding these 5 common mistakes, seniors can keep intimacy alive while protecting their health both physically and emotionally, well into their later years. Masturbation beyond the age of 60 is often surrounded by myths and unnecessary stigma, but in reality, it remains a natural and valuable part of healthy living. Far from being something to avoid, it can provide comfort, reduce tension, improve circulation, and even promote better sleep. For many seniors, it also preserves a sense of intimacy, independence, and connection with one's own body. The real concerns arise not from masturbation itself, but from the mistakes that older adults sometimes make when engaging in it, ignoring heart health, overlooking the need for proper lubrication, putting too much pressure on the prostate or pelvic area, depending too heavily on pornography, or neglecting the emotional side of sexuality can all turn an otherwise beneficial act into something harmful. These missteps may result in physical strain, discomfort, or even emotional distress. On the other hand, when approached with mindfulness and self-care, masturbation can remain safe, fulfilling, and deeply rewarding. Seniors who pay attention to their body's signals, use the right products to protect delicate skin, and seek medical guidance when needed can continue to enjoy pleasure without unnecessary risks. Gentle techniques, adequate lubrication, and openness to new forms of stimulation all help ensure comfort and safety. It is equally important to challenge the outdated belief that sexual expression is only for the young. Doctors and psychologists consistently affirm that sexuality has no age limit. Seniors are entitled to the same freedom of sexual enjoyment and self-expression as younger adults, and masturbation can play a meaningful role in maintaining emotional balance, confidence, and even overall health in later years. The essential takeaway is not that masturbation should be avoided after 60, but that it should be practiced wisely, by steering clear of the 5 common mistakes: overexertion, reliance on unrealistic stimulation, neglect of prostate and pelvic health, lack of lubrication, and disregard for emotional well-being. Seniors can continue to experience sexual satisfaction safely. Aging changes the body, but it does not erase desire or the ability to feel pleasure. With awareness, care, and the right mindset, masturbation can remain a joyful, safe, and enriching part of life's later chapters, proving that intimacy and satisfaction truly have no expiration date.